While this time last year, we were wondering if kids' classes were going to be in person, now it's whether those kids are going to be wearing a mask in class. We've already heard from the state's two largest school districts, that's Boise and West Ada. They laid out their plans earlier this summer. And despite the uptick in cases and the recommendations from the CDC that all in school should be masked, Boise still considering the suggestions, and West Ada, they're going to leave it up to the superintendent. At this point, for both, masks are optional. Well, Central District Health, which covers Ada, Boise, Elmore, and Valley counties, says they support transitioning back into in-person learning for the upcoming school year, but they also released new guidelines for schools that say they need to modify how they teach based on case counts. CDH, they're going to be using the Centers for Disease Control's Community of Transmission Indicators. You can see those on your screen. If we were to start school today, we would land somewhere between the substantial and high transmission categories. We're currently sitting at an 8% positivity rate statewide. Ada County averaging 135 new cases per day per 100,000 people, which would technically be in the high transmission category. Following the CDC's guidelines issued earlier this week, CDH says they're recommending that teachers, staff, and students do wear masks indoors regardless of vaccination status. They're also recommending a few things that we've already become familiar with, like students being separated into smaller pods of 3 to 5, and keeping 6 feet of distance whenever possible. Deep cleaning the classrooms and also those high-touched areas also need to be cleaned deeply daily. As for sports, which are scheduled to start in less than 2 weeks for some of those fall sports, that's where there may be some gray areas, because in that same document, Central District Health said today, any activity where masking and distancing cannot take place is high risk unless all participants are fully vaccinated. They're going to evaluate programs, sports, and other activities offered on behalf of other partnerships with the school to see if determine enhanced safety procedures. You can see that on your screen. How does that actually work, though, for those who are under 12, who can't get the vaccine, who want to participate in high-contact sports, or for those over the 12 years barrier whose parents have not decided to vaccinate their kids? Will they be able to participate? Those are questions we asked of CDH. We just haven't gotten a response back yet. The board of CDH made a lot of these recommendations last year as well, but like then, ultimately those decisions left up to the individual school districts. And as we mentioned, so far it's status quo. But like everything we've seen over the last year or so, things could change, and quickly, whether that be next month or even next week.